How are lymphoma MRI scans interpreted by doctors? Imagine looking inside the body with a powerful camera that reveals detailed images of tissues and organs. That's what magnetic resonance imaging scans do, especially when doctors are trying to understand lymphoma. When doctors review MRI scans for lymphoma, they focus on several key features. First, they look at the size of lymph nodes. Usually, lymph nodes larger than about 1 to 1.5 centimeters in short axis diameter raise suspicion for lymphoma involvement. But size alone isn't enough. They also examine the signals on different MRI sequences. For example, on T1 weighted images, lymphoma-involved nodes often appear darker, while on T2 weighted images, they may look brighter. These signal changes help differentiate lymphoma from other causes of swollen lymph nodes. Contrast-enhanced MRI scans are particularly useful. When a contrast dye is injected, areas affected by lymphoma often show characteristic patterns of enhancement, reflecting increased blood flow or abnormal blood vessel formation within the tumor. This helps radiologists distinguish malignant tissue from benign conditions. MRI can also evaluate whether the disease has spread to other organs, like the spleen or bone marrow. For instance, an enlarged spleen larger than 13 centimeters in vertical diameter can suggest involvement. Advanced MRI techniques, such as diffusion-weighted imaging, provide even more detail by measuring how water molecules move within tissues. High cellularity in lymphoma makes diffusion more restricted, which can be seen as bright signals on these specialized images. Doctors don't interpret MRI scans in isolation. They combine the imaging findings with the patient's symptoms, physical examination, and other tests like PET scans or biopsies. PET scans are often preferred for staging because they show how active the cancer is based on metabolic activity. MRI is especially helpful when PET or CORT scans are limited or when detailed imaging of specific areas is needed. Ultimately, MRI helps doctors determine the extent of the disease, guide biopsies, and monitor how well treatment is working. But it's important to remember that a definitive diagnosis of lymphoma always requires a tissue biopsy. Imaging gives valuable clues, but only tissue analysis can confirm the presence of lymphoma. Always consult healthcare professionals for personalized diagnosis and treatment options.